I was at my fitness center and I was playing basketball, and I was reaching out to get the ball, and somebody's forehead actually slammed into the bridge of my nose and broke my nose immediately. I immediately knew I broke it because I heard a pop.
Often patients come in and have either seen previous doctors or oftentimes had previous surgery where it's been inadequate in assessing those outside parts of the nose. So when we see the patients, we obviously take a very careful history from them and do a careful examination. And if we determine that they have a problem in which the outside portion of the nose is contributing to their obstruction, that's typically when we recommend functional rhinoplasty.
I noticed that I was having breathing problems. Throughout the day, I would notice that I'm struggling to breathe, and especially at nighttime. While I'd be sleeping, I would wake up in the middle of the night sometimes and just gasp for breath, and I have never in my entire life had problems like that.
The surgery is highly individualized based on the patient's individual problems. It can last anywhere from an hour and a half to 4 or 5 hours sometimes, depending on the complexity of the problem and the patient's individual history. Have they had previous surgery? What types of collapse are they having? How much cartilage they have left over in their nose, and do we need to reconstruct that, possibly with even cartilage from elsewhere in the body?
After the surgery, I woke up and I had the splints, I had the bandages on the nose, so I was not able to actually breathe directly after the surgery. The recovery period, I think, was around 2 to 3 days for me.
Although there is some discomfort associated with the surgery, most patients by a week or two after surgery are very glad they've had it done. Not only are they breathing better, but they're pleased with the outside appearance of the nose.
A week after the surgery, he removed the splints and the bandages on the bridge of my nose. That's when I took my first breath. And I immediately knew that something has changed because I was breathing out of both nostrils, which I've never done before in my entire life. It was a life-altering experience. I remember I was at his office and I was just so happy, and I think I gave Dr. Pero a hug.